Did you know? Diabetes is a metabolic disorder that occurs when blood sugar levels are too high and the body is unable to move the sugar into your cells to be made into energy. This may be due to the lack of a hormone called insulin or due to the body's inability to use insulin.
The rate of diabetes is 3 to 5 times higher amongst First Nations populations.
This graph shows the rates of diabetes amongst First Nations living off-reservation, on-reservation, and the Canadian population in general. You can see that diabetes rates are much higher among First Nations, especially those living on reserve.
There are a number of factors that are thought to contribute to the high rate of diabetes among First Nations. These include difficulty accessing good foods, such as fruits and vegetables, low incomes, difficulty accessing or attending schools for higher education, and increased rates of obesity.
There are a number of health conditions that are associated with diabetes. People living with diabetes are at an increased risk for cardiovascular or heart disease. In addition, diabetes is a main contributor in 1/3 of strokes and half of kidney failures. Diabetes can also cause vision loss.
Having diabetes can also be a financial burden, costing individuals up to $1,500 per year.
So what can we do?
Well, the Aboriginal Diabetes Initiative was implemented by the Federal Government of Canada in 1999. Its objectives are to reduce the incidence and prevalence of diabetes within the First Nations community and reduce the risk factors that are associated with diabetic diseases. The first phase of the program focuses on increasing awareness about diabetes to help create an understanding about the disease.
The second phase of the program has 4 main objectives. The first is to increase healthy living and disease prevention. This includes increasing daily physical activity levels and encouraging the use of healthy traditional foods in meals and removing vending machines and unhealthy options from schools. The second objective is to increase screening and early diagnosis of diabetes and to improve self-management for those living with the disease. The third objective is to create a network of diabetes workers who are trained to work with First Nations individuals and who are able to provide expertise and support. The final objective is to gather research about First Nations living with diabetes to guide future initiatives.
The third phase focuses on reducing type 2 diabetes within the First Nations population and continuing to use prevention initiatives for all age groups.
The First Nations Food Guide. Canada's Food Guide came out with a food guide specifically made to reflect the traditions and food choices of First Nations, Inuit, and Métis people in 2007. The guide has health and diet recommendations based on both traditional and contemporary food choices of First Nations people. So how can chiropractors help?
Chiropractors can consult with local representatives to provide diet and exercise advice. Chiropractors can also help to create personalized plans for eating right and exercising to help prevent or manage diabetes. Anishinaabe Health Clinic in Toronto is a multidisciplinary clinic that brings together health professionals from a number of fields to provide service for First Nations people.